Hi, my name is Sangmin. I'm the Associate Professor of Asa Medical Center and University of Ulsan College of Medicine. I'm the first author, and Consul Kim is corresponding as well as the senior author of the article for investigative and clinical urology titled Impact of de novo vesico-ureteral reflux on transurethral surgery outcomes in pediatric patients with ureteroceles. As you may know, obstructing ureteroceles in a single or duplicate renal system can trigger recurrent urinary tract infection, vesico-ureteral reflux, voiding dysfunction, and even deterioration of renal function. Various surgical options have been proposed to prevent these adverse events, including a partial nephrectomy with or without upper moiety ureterectomy and ureterocelectomy, ureterostomy, lower moiety common sheath ureteral implantation, and transurethral incision and decompression of the ureterocele. However, the best management strategy is still unknown owing to a lack of high-powered randomized controlled trials comparing different surgical options. And there are concerns about the endoscopic puncture technique focused mainly on the high incidence of de novo VUR up to 50% in the punctured moiety. And also the best method for preventing de novo VUR or UTI and the causative relationship between de novo VUR and renal functional deterioration in the long term is still unknown. Therefore, we aimed to determine the impact of de novo VUR on postoperative UTI and renal function in pediatric patients with ureteroceles. In this study, we included pediatric patients with a single or duplex system who underwent primary endoscopic puncture of an ureterocele. The indication for endoscopic puncture were huge ureterocele shown to obstruct the bladder outlet on VCUG, increasing hydronephrosis on serial ultrasound follow-up or febrile UTI. We applied two different puncture techniques in this study. One is a large single puncture and another is small but multiple punctures at the intravesical inferomedial portion of the ureterocele just above the bladder neck. A primary endpoint was to evaluate the impact of de novo VUR on the occurrence of postoperative UTI and renal functional deterioration. We defined the de novo VUR as a newly developed VUR after the operation in the punctured moiety without preoperative reflux of the treated urinary system. Primary success was defined as successful decompression of hydronephrosis after the procedure without the need for secondary interventions such as ureteral reimplantation, heminephrectomy, or repeat transurethral puncture. As a result, a total of 36 renal units from 34 patients underwent primary endoscopic puncture of the ureterocele during the study period. 22 had a duplex system, and preoperative VUR was noted in 25% of the patients, including 3 patients without renal duplication. Endoscopic surgery successfully decompressed the ureterocele and hydronephrosis in 78% of the patients. De novo VUR developed in 50% of the patients postoperatively. In binary logistic regression analysis, renal duplication was the only significant factor negatively associated with the primary success of endoscopic surgery. However, postoperative UTI, secondary operation, and renal functional deterioration were not related with renal duplication. In our study, de novo VUR after endoscopic surgery was not found to be related to primary success, postoperative UTI, secondary operation, or renal functional deterioration. As expected, the rate of de novo VUR was found to be lower in our multiple small puncture group. However, this was not associated with subsequent surgery or poor renal function. Nevertheless, we agreed that it is reasonable to make every effort to minimize de novo VUR at the time of ureterocele puncture because the large puncture technique did not have benefit for the resolution rate of hydronephrosis but showed a lower rate of de novo VUR. In conclusion, the incidence of de novo VUR after endoscopic treatment of ureterocele is 50% overall and 59% 0.1% in the duplicated system. However, de novo VUR is not significantly associated with postoperative UTI or renal functional deterioration in the long term. It may not therefore be necessary to perform lower urinary tract reconstruction routinely to correct de novo VUR after endoscopic puncture of the ureterocele. Thank you for your attention.